Hey everyone. Yesterday I visited 3 hospitals. 2 of those I visited as a specialist, as a professional, but 1 of those I visited as a patient recovering from COVID-19. So I had a lovely general practitioner and she helped me a lot, but basically I spent more than a half of the visit speaking about how I'm feeling and how I felt within the last 2 months. Basically remembering the whole diary in my brain of all of the roller coaster I've had. So let's imagine how my day would look like a little bit differently with the help of technologies. So I would wake up, and while making my morning coffee, I will be talking with my voice assistant at home with a Google Voice, Alexa, Siri, Cortana, whatever, and she'll be asking me, how do I feel, how I slept? Would I have any conditions or symptoms that my GP should be aware of? While going to the hospital, I would put on my jacket, and by putting on my jacket, on top of my sweater actually, putting on my jacket, I can tap that I use the medication by just tapping on the sleeve, and the jacket can pass information to the mobile app. When visiting to the hospital, actually, and going outside, I would have a chatbot or a digital survey about my received experience and how I feel after the visit. So my name is Emil Syundyukov. I'm a computer scientist by education, and thanks a lot. And I'm a computer science by education, and I'm using my skills towards problem solving in healthcare. And during my presentation, I'll be talking about connecting the dots, and I will try to not persuade, but tell you more about how and why I perceive digital technologies as a 21st century screwdriver, as things to fix stuff and help stuff in healthcare. So healthcare is a marvelous industry. I love it, truly, and for sure it's important. I think we all will agree that healthcare is an important field that we should all contribute to. But it also is a very challenging field. And throughout the jungle of different challenges, I wanted to outline only 3 of those that we'll be focusing during the presentation. The first one is lack of data that we'll be speaking about later on. So I just described to you the thing about, telling everything about how I felt within the 2 months to my GP and spending half of the visit to do so. And imagine this subjective data. I might forget something. I might basically, not respond to something if, the GP is asking about my lifestyle or any other things. So basically, this is a black box. We'll be touch base in the next slides. The second one, and I will leave it as a dessert to the second half of presentation, is oversaturation with data. So how can we navigate within the ocean and the tides of different data points to actually make sense out of this data we collect? And the third one is how we can use the solutions, the day-to-day solutions, to actually engage people in their own healthcare services provision. Because my point is that healthcare services is not only the passive engagement when there is a specialist and we're just sitting down, exhaling, and saying, do whatever it's needed, I'm here to receive. It's about the dialogue, and we can actually support this dialogue through data, so-called data-driven dialogue. And we'll be touch base on this in the later slides. And for sure, if we look at the patients, there is a patient journey, so we are wanderers. And for sure, hand in hand with our healthcare professionals, or also researchers coming from academics and industry side, we go, it's actually not a straight line how it's on the slide, it's a roller coaster. So it's basically a lot of ups and downs, and I think you all have experienced on your own some of the healthcare services and some of the journeys you've been with during the same pandemic or any other conditions you might have. But basically, if we are about to structure this, and as a computer scientist, for me, it's easier to structure stuff, we have major stops there, starting from a prevention and screening, where we have a broader population not attending the hospital, living outside of the hospital, and how we can identify certain risk factors, personalized both the communication as well as the call to action to prevent the disease and the prevalence. Going further to diagnostics and personalizing the diagnostics towards treatment and treatment monitoring, both at home as well as at hospital, as well as the rehabilitation in any other services. And for sure, since we're speaking about tech, we'll be speaking about whether technologies and whether tech can be so-called 21st century screwdriver. But actually the question is why I'm so obsessed about computer science and computers. Why computers? And there are many answers to that, but some of the factors why we speak about computers is a broad and enormously broad amount of applications. Talis was speaking about day-to-day examples, how we can apply tech within, bushfires, space tech, environmentalism, but we'll be speaking about the healthcare today. And for sure, one of the factors is the size. So we went from big computers, actually still stayed there, for the industrial applications, lab applications, any others, towards the smaller ones. So what is the smallest computer you've ever seen or held in your hands? A phone, a wearable device, am I right? So we went to smaller device that was inserted in my jacket, something like this, and even smaller ones like this. So what we see on this 1-cent coin is a concept developed in the Michigan Institute of Technology called Smart Dust, basically aiming to develop a 1 cubic millimeter size computer that can actually sense. It has sensor on top of that can send data to the server or to another node with a radio, and it has a small solar panel, so it can live it on its own, and we can deploy it in this room or any other places whatsoever. Another application, for sure, the way how we communicate with computers, and it's the language, the same way we use English, we use algorithms, we use math instructions, and we went from and still are there in some applications, from very low level or math instruction and abstractions towards a very high level ways how we communicate with computers, so we can give an ability to build to anyone in this room and beyond. And as an example here, most of you have heard about this or tried. It's MIT framework called Scratch, an open source framework with a blockly type of programming, basically building blocks to make the cat dance, sing, run, jump, whatever you would like to do him. But we can apply the same blockly programming type of communication to actually program sensors and Internet of Things solutions to help us in industrial applications as well. And another enormous thing that we'll touch base in throughout the examples is the ability to sense. The same way we see here the mole who is blind, he has its nose with testicles, to navigate throughout the world to do whatever he needs, the same thing we gave to computers through sensors and ability to feel. And throughout the broad application, as I mentioned before, in various industries and day-to-day activities, for sure healthcare is what interested us during this presentation. And as a computer scientist, I look at myself, and you can look at yourself now as well. I do see not only the complex biological system, but a source of enormous amount and types of data. And we should work with data. Why don't we do this? And we touch base the first example of the black box, so basically lack of data. So let's try and use the tech to actually open up and act-base the data inside. And how we can do this, actually, it's not only the rocket science, it's actually day-to-day applications that we can utilize to start opening these black boxes throughout the whole patient journey. One of the examples is using wearables. How many of you do have a wearable device, smartwatch or smart ring, whatever it is? Raise your hand. Okay, a lot of hands there. Also, might assume some people online can raise their hands as well. But basically, it's not only to communicate or to be notified that, hey, I actually missed my lecture today and the Siri responded. Well, it's actually to how can we apply this towards managing pandemics, as the World Economic Forum reports. In Harvard University, together with researchers from Stanford and other institutions, actually utilize the power of smartwatches with the optical sensors, movement sensors, guide sensors, temperature sensors, smart rings like Oura Ring as an example, to see the changes, the small changes in your paradigm of movements, temperature sensing, etc., to actually state that, hey, this person is of risk of pandemic. And it's not only about the one person. If we extrapolate this layer above, we can see that the small dot of a person who might get infected, we can model how the infection and pandemic can be moving throughout the city, throughout the country, throughout the region. And for sure, as I was touch basing about this macroscopic approach, one example that actually touched my heart, also in a direct manner, is a project called Cardiogram. University of South California designed a solution that I am also using it right now, so I can get some trends based on my demographics, how my heart behaves using the optical sensor and movement sensors. But it's not only about me. It's actually, I'm sharing this data as well as 500,000 people right now in real time with the researchers fighting and finding new ways how they can diagnose cardiovascular disease-related risks. So the study is called eHeart study, helping us to drive new changes within this disease domain. Another example is pediatrics, and the Children's University Hospital here in Latvia designed a very simple solution, basically to help parents whose children suffer from COVID-19 to study long COVID symptoms and to do this triage to understand who to call to the hospital, because parents got worried. They were calling the hotline, whatever happens at home, they were stressed a lot, you might imagine so. So basically a simple solution that we can use within the bachelor thesis or any other courseworks, digital surveys. Once the patient was discharged, they sent the link through SMS. People can hop in, fill in the diary, receive educational materials. Meanwhile, doctors can see the triage, the red flags corresponding to certain patients, so they can react accordingly. And one of his examples for sure in the managing pandemic was the platform developed with the Boston University and Holland Institute of Israel, and our researchers in Latvia as well, how they utilize the same solution to actually engage broader population in chronic condition, understanding the risk factors of chronic condition within COVID-19, and then understanding the vaccination readiness 2 years ago based on the risk factors to personalize the call to action, to personalize the communication with certain groups of society. Another example in public health is, once again, utilizing the day-to-day digital tools in women's health. So more than thousands of women in Baltics were engaged in this project, which basically means that every woman hopping on the platform filled in their own personalized breast cancer risk assessment or reproductive health risk assessment test, receiving the personalized report on their mobile phone or a computer so they can use it as a call to action to talk with a professional. Meanwhile, with the help of dynamic consent, they were engaged with the researchers to work hand in hand within the breast cancer research and epidemiology. Day-to-day examples, so virtual reality, the solution called Big Screen TV that was used to actually get your friends together and watch movies through the VR headset during pandemic, quite popular, huh? But actually this solution was used also to conduct group psychotherapy sessions, because you have an avatar, you're protected, you're sitting at home, and you can open up about your stress, about any things happening, any roller coaster things happening during your day-to-day life to a professional there. Voice-based solutions, I was touch basing in the very beginning, and I'm very, very interested in this topic, is because this is one of the most robust way how we can communicate, because you don't need to type anything, you don't need to log in to anywhere, you just talk. And some of the examples there is for sure managing the medications like Alexa developed in the US. So once you're getting prescribed with a drug, it understands how many pills do you have left, so it can purchase a new pack of pills to you and tell you where to go to take your prescription drugs, and also notify you that you need to take your drugs on time. And another example is Children's Hospital for sure. The same diaries I was talking about in Latvia, the same one in Boston Children's Hospital was developed through the voice data. So the digital diary, calming parents, educating parents, meanwhile receiving the data by the healthcare professionals to help them to act accordingly. And it's not only about voice, it's also about the social networks, the social media that we're utilizing and using to communicate with our friends. Ask Maya in Malaysia was developed together with Bayer and researchers in the APAC region to actually ensure that ladies get educated and they have a safe space to talk about oral contraception because of social and other stigmas that appears in the region there. Designing the smarter products. I was using this jacket not because I'm cold, actually a little bit, but nevertheless it's about designing the smart apparel, the smart things that we can wear. And the product Jaguar developed by Google and Levi's actually does the same thing. So I can touch and program my sleeve to notify, to mark whether I took pills, to help me to navigate to the right department in the hospital, and sometimes it's a jungle within the large hospital environments. So we can use such solutions to do this. So we open up the black box. What about this oversaturation with data? And it's not a secret that we generate enormous amount of data in a daily manner. So how can we navigate throughout these oceans of data? Because we generate a lot of noise. We cannot just put it as a huge dashboard to the healthcare professional, tell, now you play Sherlock Holmes because you have only 20 minutes. Come on, you can do this. You can, navigate and do both jobs simultaneously. So we have the dots here, and the dots can be perceived as the data point about my heart rate, your heart rate, any other biomarkers, or as well will be touch based on your skill set, not only engineering skills. I've seen people raising hands on the social skills. It's all represented here. So what should we do with these dots? The same thing we're having the children books with the numbers on each dot. We can interconnect them all together to receive a brighter picture, something like this. I don't think we will receive, Claude Monet from the dots before, but nevertheless, you got the point. And it's not only for sure about the technical skills, etc. It's about intercombination of different professions, different faculties, different skill sets, in order to design intuitive solutions touching the very hearts of people involved, both patients, professionals, as well as academic and industry. And this concept is developed by the MIT Health Design Thinking Lab by Bong Hu and his colleagues to actually not run and design and develop and code, and I know computer science love to code, but it's actually sitting down, understanding, and looking into the day-to-day routine in certain departments to understand the pains, to understand the things that people are craving for, and then going back with the simple prototypes, with the day-to-day solutions to help them achieve that. And this job is not only about computer scientists, okay? So it's about basically building the bridge between the STEM professions, such as computer science, electrical engineering, mechanical engineering, etc., healthcare professionals, as well as the lawyers, designers, business, any other social science-related professions. So we should build this three-type of triangular bridge there to connect and to work hand in hand here. And for sure, one of the things is digital skills. As an example, right now, Children's Hospital is developing this DigiHealth one-on-one concept to actually give ability to healthcare professionals, not to become the coders, but to actually extrapolate their day-to-day challenges towards that, hey, this guy's actually code mobile apps. It might help me to, to orient my patients or to ask them some questions before or after the visit. So this type of things, once again, I'm putting it here, so interconnection of different skills is something very important. In order to finalize, and we have 30 seconds left, is 3 things that I would like to put there, and we can discuss it later on during coffee break, is always look across the fence. So I'm as a computer scientist, it's not only coding for coding purposes, it's actually understanding how I can apply my skills in different settings, like healthcare as an example. How can I help these guys working 24/7 with the solutions I can automate? Don't be only tech-guided, use it as a tool. And I showed you that day-to-day solutions can be utilized for the help of the healthcare. And for sure, as the last one, join us to drive the tech in healthcare together, because healthcare is one of the most important things that we have in our lives. Thank you so much.